Kim, thanks for joining us.
Sure. Thank you for having me.
Tell us where Riverside County stands right now in terms of the pandemic, especially now that it has the highest amount of COVID-related hospitalizations it has ever reported.
Yeah, we definitely are experiencing a dramatic surge related to the pandemic in Riverside County, similar to what's being seen statewide and across the country. We are reporting large number of cases. The increase in the number of cases is the sharpest increase that we've seen since the start of the pandemic. And then, as typically happens with disease process, we see an increase in cases. Then a few weeks later, we see an increase in the number of hospitalizations.
What kind of patients are being hospitalized throughout the county? Is it mostly older, minorities?
Yeah, so we do continue to see impacts on the populations that are hardest hit, being the Native Hawaiian Pacific Islanders, African Americans, the Latinx population. Certainly that is continuing to play out in hospitalizations. But this virus, as we've seen, it can attack people differently. And so while we think of those most vulnerable populations at highest risk, really everybody needs to take safety precautions to prevent transmission of the virus.
Has any business sector seen a notable increase in outbreaks, or is this mainly through private gatherings?
So our contact tracers do try to get to the bottom of where people have been infected, and we do monitor outbreaks. Those reports are available on our website. We have seen clusters of cases in grocery or food retail locations, in regular retail, a few in restaurants and food distribution and warehouse. So if you think of places where people typically gather, they may or may not have their mask on the entire time because either they're eating or something else is causing them to take it off. Those are the areas where we have highest risk of transmission and certainly expect to see outbreaks in those areas.
You mentioned contact tracers. Have they had more difficulties tracking where cases are coming from? Are people now being less cooperative than they were before?
I don't think people are being less cooperative. I think that has stayed relatively consistent. I would say we get around 60% of the people that we contact are willing to give us information. I think that the challenge is when you have such a high volume of cases, it's very difficult to tease out the exposure. And so one of the things that I always give as an example is if you went to work in the morning and then you stopped at a grocery store on your way home and then you went to a barbecue at a family member's house, and you become sick a few days later, where was your source of exposure? It's very difficult to tease that out at the granular level. So our contact tracers really have to rely on multiple people reporting a particular exposure in order to pinpoint that. And when we talk about family gatherings and gatherings in private households, that's difficult to do. We do think, though, based on the fact that we don't have a lot of outbreaks tied to retail establishments or places of business, that there is a lot of spread going on by gatherings, either at private homes, or even places that are maybe a little bit more public.
Are there any plans for Riverside County to follow LA County's lead in either placing more restrictions on business sectors like restaurants, or even implementing its own stay-at-home order?
At this point in time, we have not gone down that path. So the Board of Supervisors is the one that makes that decision. They're the policymakers for the county. I provide them with the information they need to make a good decision, as well as other colleagues leading other county departments. I think that at this point in time, the board has decided that we are going to stay lockstep with the governor's orders. And so we are not at this point discussing implementing any additional restrictions locally. Although I will say this is a very dynamic situation, and depending on what we see going forward, that will be a decision that the board has to make.
Hospitalizations across the state are surging, and there's concern that the Thanksgiving holiday could even triple the amount the state has for hospital beds in just a few weeks. So for Riverside County, are hospitals prepared, and what plans are in place if that does happen?
So we've been working for many years with all of our hospitals and healthcare facilities around the county for this type of scenario, to plan for a surge response. And so I feel very confident that our hospitals are all working very closely with us. They're working very closely with each other. They're sharing best practices. They're sharing ideas to maximize staffing resources. So I think that in terms of space and equipment, we have plenty of ideas and opportunities for expansion. Really, our rate limiting factor at this point is staff. When we had a surge in July, we were at a little bit different stage than the rest of the country. And so we were able to pull resources from federal assets and other areas of the country. Now the entire country is experiencing this surge. And so those federal resources have already been deployed. And so the number of resources available to our hospitals to augment their current staffing levels are not what they were back in July.
Nearby San Bernardino County recently limited the use of ambulances that it sent out to 911 calls so they could respond to more coronavirus-related emergencies. Does Riverside County expect to do anything similar, and if so, when?
So our EMS agency in Riverside County has protocols in place for dealing with when we have limited resources. We have not had to flip the switch on those protocols yet. Our EMS agency monitors transport numbers and the amount of time spent on each transport on a daily basis, multiple times a day. So they have a very close, they have a good finger on the pulse of what's happening. So I'm 100% confident that if there is a need, then they have the ability to flip that switch, but we haven't reached that point yet.
Okay. The county is now starting to roll out a self-administered test in addition to the standard PCR test. Is the new testing method just as accurate as the PCR test? And should residents have any concern about false positives or negatives?
Yes, so we recently executed a contract with Curative Labs. So it actually is a PCR test that Curative Labs runs. The difference is the way that we were doing it required a nasal or throat swab. With Curative, it's actually a less invasive process. So the person takes the swab, puts it in their mouth, and then gets a sample that way, rather than having a medical professional perform essentially a medical procedure on somebody to get a swab or a sample.
What plans are in place, Kim, for distributing a vaccine when it first arrives? The state has said that healthcare workers would be prioritized. The CDC recently said that residents at long-term care facilities, they should also be prioritized. So do we know who will be vaccinated here when it first arrives?
Yes, so Riverside County will follow the CDC and state's lead in that the first tier of individuals to be vaccinated will be our frontline healthcare workers, most likely in our acute care hospitals, so that we can keep those workers protected so that they're able to care for people who are most in need of hospital care. We anticipate that we will get the initial shipments of vaccine probably within the next few weeks. It will not be anywhere near enough to vaccinate the entire number of healthcare workers that we have. So we'll be working internally and with partners with the hospitals to figure out how we'll prioritize that initial shipment and get the broadest coverage that we can with what we have.
All right, Kim, we appreciate your time. Thanks so much for joining us.
No problem. Thank you so much for having me.